Hi, my name is Dr. Habib. I'm a medical doctor. I'm the owner and founder of Next Health. Started in almost 2001, looking into functional medicine and lifestyle. And today I'm going to introduce you to a colleague of mine, somebody I respect. He's double board certified in preventive medicine and naturopathic medicine. And we're going to talk about some very interesting subject here. So I want to introduce you to my good friend and a very smart guy. His name is Dr. Hafid.
Hey, my name is Dr. Abdullah Hafid, and I'm a physician. I've known Dr. Habib for over 10 years now, and we've been working very closely in the last year. So I'd like to start off by asking Dr. Habib a few questions and getting his thoughts. Right now, there's a lot of information out there about Alzheimer's and what kind of drugs are available or treatments. So I'd like to get a little better idea of what Dr. Habib does in terms of addressing Alzheimer's, what type of therapies he likes to utilize in his practice.
Thanks, Dr. Hafid. This is a very interesting topic because it spans the breadth of young people, middle-aged people, and older people. Because for the old person, it may be a diagnosis of Alzheimer's or some other degenerative neurological disease. For people in the middle age, it could be, for example, they're forgetting where the keys are, they don't know where to park the car. But for young people, it's slightly different. It could be more about the function of the brain, the health of the brain, the ability to be focused and recall things, be sharp. So the reason why I bring that up is because people often try to isolate a condition like Alzheimer's and assume that it's only exists there. But I'm going to tell you one thing: amongst the young, the middle, and the older age group, men and women, genetics definitely can play a role, and I'll tell you how significant that is. But what is overwhelmingly true for all the different age groups is something called inflammation. And really, inflammation is very interesting because there is a research drug out there. It's actually based on a monoclonal antibody to address inflammation. And so that's what we're going to talk about today is that memory, is it just something that happens when you're old, or is there a process? Could genetics be involved? And how does inflammation really take place? And what's the consequence of inflammation? And of course, there's so much in sort of talk about amyloid. We're definitely going to talk about the values of it and the limitations of focusing on the amyloid story. So let's pan on Dr. Hafid here and see what he has to say in a couple of sentences.
Yeah, so this is a very important topic that we have to address, especially in our society, as we address something called the silver tsunami, which is the highest group of individuals reaching 65 and above in our society. That's going to affect how Alzheimer's is seen and perceived. So, having different types of treatments and therapies out there to help our clients and our patients thrive in a world where they don't lose their lives just because their brain isn't working as it should, it's going to be important for us to address, especially at Next Health, where a lot of our patients have a desire to live to 100 and beyond and to be part of what we call the blue zone. So I want to really emphasize that this is something that's going to be rapidly changing, and we have a lot of exciting things that we can offer, but not to take away from what's out there right now.
Well, so really, it's very appropriate to talk about who is susceptible to memory problems. And so there is a gene, and we'll touch upon it, but I want to bring that up later. That's called the ApoE4 gene. So if you have that, there is a moderate to high risk of cognitive decline, namely Alzheimer's. But it's not specific to Alzheimer's, it's memory as a whole. But the thing about inflammation is that almost all age groups can be affected. So if you're young and you have inflammation, you can have symptoms like ADHD. So inability to focus, inability to be able to stay on task, and the lack of flexibility. And whether it's the young person, the middle age, or the older person, you'll find that inflammation impacts the ability for the organ to function at two levels. The one is at the neurotransmitter level, and the other one is at the basically how can we say this, at the neuronal level, the function of the nerve and its connectivity. And so inflammation is very, very important because inflammation can interfere with not only the symptoms like, should we say, visual disturbance, right? So why is visual disturbance a sign of inflammation in the brain? Inflammation in the brain affects blood flow, and that blood flow is synonymous with the blood flow to the retina. So that's why when people in the military are exposed to toxins where they have inflammation, they may complain of blurred vision. In fact, based on military experience, a test that's called a visual contrast study has been available for many, many decades now, where if you're not able to visualize the difference in contrast between a black and a gray, and that test goes through a sequence of different shades, making it increasingly more difficult. When you reach the limit of your ability to differentiate the two different shades of black versus white or gray, that can be a sign of neuroinflammation, because the blood flow that may be impacted in the retina very closely aligns with the lack of blood flow in the brain in the setting of, say, toxic exposure in military setting. That's how this test came about. So look, how many people when they're young even think about it? I consider myself middle-aged. I'm not old, but I'm not young anymore. So it became more relevant for me because I would notice changes in my sort of blurriness. Is it because I went to bed late and woke up early, or I woke up with a disturbed sleep? That's definitely a reason for it. And for someone like myself, I'm more interested in understanding what are the consequences to me maybe eating late at night, like 1 hour before I go to bed, particularly if it's a high in carbohydrates, because this can set off a high insulin level. And if you get older, if you have insulin resistance, that could be a really a very negative environment, because insulin resistance reduces the fuel, and insulin resistance increases the blood, or should we say, decreases the blood flow to the brain. And so I would say inflammation comes up because not only is it relevant for young people that have sort of anxiety, depression, ADHD, inability to sleep. Young people are having these problems. And how about middle-aged people? What do middle-aged people do? Some of them have pre-diabetes or diabetes. They have borderline high blood pressure or high blood pressure. This is very relevant because inflammation is not only at the root of those conditions, but the inflammation can cross the blood-brain barrier. So when we talk about inflammation in the brain, oftentimes it comes from the body and crosses the blood-brain barrier. But you can also have inflammation in the brain directly at the brain. How? An example might be head injury. That's easy, right? You knock your head, there's an injury, there's going to be acute inflammation. But you can also have acute inflammation in the brain from toxic exposure. You can have inflammation in the brain from chronic stress. That's another area that we can discuss today, because inflammation, chronic stress, these are prerequisites. They're not the known risk factors for Alzheimer's, because it's heavily on genetics like ApoE4, and some of you may be aware of it. There's a variation called 3-4 or 4-4. The problem is 4. And the reason why there's two numbers is because one number comes from the mom, one number comes from the dad. The number 4 is problematic. So if you have number 4 ApoE from mom and number 4 ApoE from dad, you have 4-4. That's a very high risk of dementia. Dementia means memory decline. Not necessarily Alzheimer's. Alzheimer's is the buildup of a lot of amyloid as well. And if you have the ApoE 3-4, so one parent gave you 3, that's not as problematic. One parent gave you 4, that could be sort of moderate risk, not high risk, moderate risk. And that can apply with another variation, which is called, say, ApoE 2-4. Again, the 4 is the problematic one, 2 is another variant, a normal variant. So look, genetics is important. We're going to touch back on genetics a little bit later, particularly for the dementia, but we're talking about sort of so-called middle-aged people. So for myself or my peers, I mean, I can't tell you the number of times people, they wake up with a fog. What does that mean? It could mean a lot of things. We're going to discuss that today. because it's not a good sign. One off, no problem. If you're relying on coffee multiple times in the week, why do you need that? Well, because you like it, fine, but you need it, that's a different problem. Is that a inflammation problem? Why do you need that? Is that related to something in the body versus the brain? So this is the mystery of the human being. And the fact is that when you have a brain problem, you cannot just assess the brain. If you go to a neurologist, how many of those neurologists are checking for inflammation? Not many. That's zero, but they're not far from zero. Not many at all. How many are looking for insulin resistance? Not many. It's the holy grail of a type of insulin resistance that some people describe as diabetes type 3. Now, that's losing favor because, it really isn't diabetes. But what they're trying to say is that diabetes is a problem with the insulin receptor. If you're a sort of insulin dependent diabetic, diabetes is a problem at the insulin level for the mature type 2 diabetic. And the idea of the type 3 is to say that insulin receptor plays a big role in getting fuel into the brain cell. Once you have glucose in the blood, the only way to bring it into the cell is the insulin binds to the insulin receptor. So if the insulin receptor is not working well, we call it insulin resistance. So the insulin can't bind, and as a result, the body lives at a higher insulin level. And that in itself can be a problem for people that are trying to lose weight. They have a problem where the sugars are not quite right. And so that's synonymous with not only prediabetes, diabetes, even borderline blood pressure and high blood pressure. And you find it in memory problems, not least Alzheimer's. And so now with the older people, sure, ApoE, when you have the 4 variant, the 4-4, very high risk, relatively high risk, and then the 3-4 or 2-4, moderate risk. They have to be respected. However, one of the most important things to understand is that your DNA is not your destiny. That means that I have the ApoE4 gene. It's the 3-4, so it's moderate risk. But that gene cannot cause a problem provided I don't allow inflammation in my body, provided I don't allow insulin resistance in my body. The real crux of the ApoE4 gene is primarily one of making more cholesterol, making it easier to potentially get insulin resistance. And the more important one is that when you have products from metabolism in the brain, those products like amyloid need to be eliminated. Everybody makes amyloid. It's a protein. It's a necessary protein for function. Too much of it is bad. And one of the reasons you have too much is because the inflammation causes damage. The damage results in repair. The repair tissues are like proteins that are not functioning very well. We call them misfolded proteins. And an example of a non-functioning protein or a misfolded protein is amyloid. And so if you could eliminate those, you'd have no problem. And if you cannot eliminate them, so people with the ApoE4 gene, the 3-4, the 2-4, or the 4-4, they cannot eliminate those toxins. Now you may ask, well, how do normal people eliminate toxins? You eliminate those toxins by having a good night's sleep. Because when you have a very good night's sleep and you go into deep sleep, we call it delta sleep. And in sleep cycles, it's never just one time. You go cycle in and cycle out, cycle in and cycle out. So it's usually a few cycles of like slow wave, and then the deep delta waves, followed by the REM waves. So you go through these cycles, and it's never one. It's usually more. And the ability to the variation between individuals, that some people tend to focus. They have a tendency towards the REM sleep, and some people are light sleepers, and some people are deep sleepers. There's a lot of variety. But the crux of it is this: in order to eliminate toxins when you sleep, you have to get into deep sleep, which by definition is delta. It's arguable how long you need to be there, but we do know that when you go into deep sleep, that's when you allow those toxins to eliminate. we call it the glymphatic system. If you're familiar with the lymphatic system, that's where you get a cold and you have lymph nodes that you can touch. You have strep throat, those are lymph nodes. Some people have lymph nodes in the armpits. This is an example of the lymphatic system. So in your body, it's called the lymphatic system. The same system is connected to the brain. It's called the glymphatic system. So when I describe toxins built up of abnormal proteins like amyloid, and the system that eliminates these toxins are the glymphatic system, which is very active during the night, particularly in deep sleep. So one of the risk factors for cognitive decline, for decreased memory, and even Alzheimer's are people that have limited sleep, either by choice or because they have sleep disturbance. So people medicating themselves for insomnia, that sleep disturbance, may not actually solve the sleep problem of actually getting into deep sleep in order for brain health. So the health of the brain, amongst many things like fuel and blood flow from exercise, are things that impede the function through inflammation, and then an inability to access the right fuel because of insulin resistance. And the third component is that we need to eliminate, we have to have a drain. And that's called the lymphatic system in the body, but it's called the glymphatic system in the brain. And so, so I want to just pan out to Dr. Hafid here and just see if I made sense there and if there's an area. So we're going to pan out to Dr. Hafid right now and just see if, he has another angle on what I just described.
Yeah, wow, really powerful stuff and revolutionary stuff by Dr. Habib. I really touched on really core aspects of brain optimization, how you're able to address certain areas that can be a real problem for brain function. Looking at ApoE, looking at chronic inflammation, looking at the glymphatic system, and then tying that all together will really address kind of the core issues of what we are faced with nowadays. In terms of how we can take some practical advice and what we can do from there, I'd like to kind of go back to Dr. Habib and then ask him, what are some kind of low-hanging fruit that we can grab onto and we can utilize and we can take advantage of to help address some of these issues that you're speaking about?
I knew you were going to come up with a smart question because, the person that's smart asks the right questions. And if you understand the three components about inflammation and then tapping into the right fuel, in other words, you have to address insulin resistance. I'm leaving the best to last. Sleep, sleep, sleep. If somebody asks you what's the most important thing for your brain, sleep. If somebody asks you what's the next most important thing for your brain, sleep. If somebody asks you again, what is the most important thing for your brain? Sleep and quality sleep. Oftentimes people ask, should I have 8 hours sleep? Should I have 10 hours sleep? Well, the line that we use is between 7 and 9. But you can tell by the look of my face that it really doesn't matter because everybody's different. What does matter is, do you wake up feeling rested? So it wouldn't matter whether you had 10 hours sleep. If you wake up unrested, you have a problem. You could have 6 hours sleep and wake up very rested. It could be fine. So I would say that that's a really good gauge of whether you had sleep. Do you wake up feeling rested? The second component is that, do you then have the stamina to feel constantly good or energetic throughout the day? Because if you're dipping in the afternoon, that could also be a sign that maybe it wasn't restful sleep. And when you have sleep disturbance over a long time, we describe it as like chronic stress. Those people tend to maybe have energy in the morning, but they may dip later in the day. And what happens is when people have chronic stress that affects sleep, what tends to happen is that they have low energy maybe throughout the day. So there's a connection between sleep and cortisol. Initially, your body responds in a positive way, but over time it gets fatigued and cannot produce it. But the sleep is also a stress. So people with sleep apnea have low testosterone. I describe sleep apnea, which is not really sleep disturbance. That's where you don't breathe. You stop breathing. The apnea means to stop breathing. But I brought it up because that is like disturbed sleep, but for a ventilation. Ventilation means where the airway is open or closed. So when it's closed, it's called apnea, and that breathing difficulty that interferes with sleep up to 200 times a night. The client is asleep, but they wake up unrested. Maybe they don't snore or they're not aware of it. Maybe they don't know that their headache in the morning is because they're not getting the right ventilation from sleep apnea. But that's also not only a risk factor for low testosterone, but also memory because of sleep disturbance. So I emphasize that quality sleep, the duration can be between 7 to 9 hours. It's more important to get that 7 to 9 hours in a certain window, which I'm going to describe. Based on evidence on blood pressure, people who take blood pressure pills, what they found by sleeping for 8 hours in a certain window, there were beneficial effects on their blood pressure. So this was an objective way to see how sleep might affect blood pressure. And because blood pressure is such a standardized thing, such a well-known thing, that you can extrapolate that to other areas. And I'll just give you a pointer. People that have night shift work, they're working at night, sleeping in the day, they have insulin resistance, they have more diabetes, they have low testosterone. So there is lots of evidence to show that if you don't sleep at the right time, you have problems. But this study that showed what happens to blood pressure when people slept 8 hours, they found that the people that went to sleep at 8 p.m., woke up at 4 a.m., that 8 hour sleep had the best blood pressure. For those people that got 8 hours sleep from 10 p.m., excuse me, to 6 a.m., didn't have as good. Now, I'm not saying it's wrong to go to bed at 10. I'm just giving you data. And the other piece of data is people that got their 8 hour sleep, but they went to bed even earlier. Like for whatever reason, they went to bed at 6 o'clock and woke up at 2. Their blood pressure, as you might guess, wasn't the best. So there is something to be said about what we call the circadian rhythm. And so one of the things that people must understand is that that window between 8 and 10 p.m. is a good thing to do. I know many people that go to bed at 8:30. In fact, many children go to bed at 8:30. Why? Because their brains are growing, they need it. You know what? I think older people need it because the brains may not be growing, but they need a lot more recovery. They need a lot more detoxification. They need to eliminate a whole bunch of junk because of many reasons that we've alluded to and we'll continue to talk about. So sleep is the most important thing. When you go to sleep, it's very, very important. Understand also that this is not a lecture on sleep. It's almost going to sound like a lecture, but so I'll wrap it up by saying people focus on the night and they forget the day. So in the day, you must wake up at the right time. In the day, you must go get the light in your eyes. We're not talking about direct sunlight in the eye. Be outside so the UV light enters the eye. People are afraid of UV because of all the negativity, but before 12 o'clock, the UV light is actually energy for the mitochondria in the retina. The mitochondria in the retina now communicate with the brain to tell them it's day. That's the beginning of the circadian rhythm. If the body and the brain knows when day leads to night without you even explaining it, it's an automatic reflex that you're going to get a better night's sleep. So waking up with the right rituals in the morning, keeping your stress level down in the daytime, at least get to the light, maybe walk a little bit, and then think about not eating too close to bedtime. Minimum, not 2 hours beforehand. A lot of people will say 3, some people will say 4. Good luck with 4 hours. 3 is definitely doable. 2 is a good target to begin with. And frankly, if you're eating right before you go to bed, well, let's stop eating half an hour beforehand. So it's not about the same size for everybody. The most important thing, as Dr. Hafid will agree on, is it's better that you set yourself a target that's achievable, achieve it, then move to the next one. This is not a race. Your health is not a race. It's a journey. It's a journey of routine. It's a journey of make sure it fits into your lifestyle, not the doctor's lifestyle, not the ideal. There's no such thing as ideal. And I would say that the other thing about sleep is that for people who have difficulty falling asleep or staying asleep before you turn to drugs and before you even jump to melatonin, there is enough research to say that if you have a hot bath 1 hour before, some people say 1.5 hours before, there's documented better quality sleep. And I can give you so much scientific, and if we have enough time today, we'll talk about the scientific basis. I'll allude to what happens when you have heat. Heat shock proteins repairs the misfolded proteins. Heat shock proteins can eliminate buildup of old things through something called autophagy. Now, those are big words. I just threw them out there because that's what we're going to talk about next. We're going to talk about real science as it pertains to longevity, healthy aging. We're going to give you real practical scientific basis, but then bring it down to simple terms like I just did. I just spent the last literally 5 or 10 minutes just talking about basic sleep. And the take home, one of the major take homes is start the day right. And at the end of the day, for people who don't have a hot bath, have a hot shower. So what happens is 1 hour before you go to bed, that heat that is generated has to be liberated. As your body is liberating, reducing, eliminating the heat, the brain can actually lower the brain temperature. So what we find is that during deep sleep, not only are we able to eliminate toxins through the lymphatic system, our brain temperature drops by 3 degrees. Isn't that amazing? And that's why eating close to bedtime, when you're eating, you produce heat. It's called thermogenesis. When you haven't eaten all day, you feel cold. After eating a meal, you may feel hot. So if your body is hot, your brain is not going to reduce the temperature because the brain and the body are connected. So, I'm going to spin to Dr. Hafid now to see if any of those things resonate. But I just mentioned one thing. And if you can just do that one of any of the things I just said, that's a great place to start. And we're going to bring in the other aspects because it's relevant for hypertension, it's relevant for heart disease, insulin resistance, diabetes, high cortisol, obesity, arthritis, you name it. And it's not a sleep problem, it's a global problem.
Again, really powerful stuff from Dr. Habib. We want to kind of reiterate some of those things that he had spoken about in terms of sleep. Those of you that have a nocturnal schedule, being able to regulate that in addition to when you're supposed to eat and stop eating in terms of your sleep cycle and how to regulate that, but then also looking at a few other things I like to add on. Mindfulness, being able to engage in those topics and being able to have potentially a journal too. So mindfulness meditation and journaling could really help with regulating some of these emotions and some of these brain waves. And this is a topic I want to address secondly with Dr. Habib is, this is something that we do at Next Health, and we do it pretty well, looking at your brain waves and looking at how your brain function is. We use a number of tools, but they essentially are getting to understand how your brain is performing. Performance is a big idea and a big way that we like to assess, measure, and then have a plan to address any type of deficiencies or limitations that may be. We do this through different products and different tools, and really addressing how brainwaves can be something that can affect health. So I'd like to pass the baton over to Dr. Habib to answer any questions that may be there from the audience, and we'll take it from there.
Well, I think the brainwaves is fascinating. So there was a question which I really want to answer, but when it comes to brainwaves, I want to leave you with a snippet that's going to really, I think, get the saliva going, which is to say this: when you have passion and love, you activate the gamma waves. That's the highest frequency wave. We have now found that gamma waves activate the lymphatic system. So that's one of the ways to have a clean brain. Be very happy, passionate, find love in something and everything. So the question was a 92-year-old grandmother who had been diagnosed with dementia because she'd always had a problem with sleep. So sleep, one of the worst service you can do. Now, this is all on social media, so whatever advice I give you is for education purposes. You really must seek your doctor's advice. But I'm a real doctor, so I'm giving you a hypothetical. But when I give you a hypothetical, you know what I mean. So I can't tell you the number of people that go to a sleep doctor, a neurologist or a pulmonologist looking to get help with the sleep when really all they got was a sleep apnea study. Did you stop breathing? When in fact, even if those doctors were educated on sleep, you hear nothing. So brain waves are like EEGs. When your EEG has certain activities, that's when your brain waves are changing. And the fact is the brain waves are, there's no one good or one bad. There are many different waves. You have to go through them all. In fact, your personality is no more than your neurotransmitters and your brain waves. Of course, there's a certain characteristic, but a healthy brain is the ability to go through the different wavelengths, really, the different types of waves in your brain, and the ability to adapt brings out the best capability of the brain. So one of the things I want to tell you is that because I'm from London, we talk about an ex-prime minister, first female prime minister. We talk about presidents in America, we have prime ministers, and she was called Margaret Thatcher, the Iron Lady. This was in the 80s, and she prided herself in having privatized all the national health systems like the train and so forth. And so that was a claim to fame. And the other claim to fame that she had was she would survive on 2 hours of sleep. Needless to say, she became demented. Okay, so there I rest my case. It's not scientific, but I rest my case. So I would say that now what was very interesting is that of all the treatments that are out there for Alzheimer's, every single Alzheimer's treatment that involved getting rid of amyloid, no matter how successful the drug was at eliminating and frankly eliminating all the amyloid, memory did not come back. Billions of dollars have been spent on anti-amyloid treatment. The treatment is so good at eliminating amyloid, even when there's zero amyloid, which I'm not sure is a healthy thing, there is no recovery in the memory. Now, why did I say that? I said that because the root of the problem, no matter what neurological problem you have, if it's not between decreased blood flow and less oxygen in the brain, it's inflammation. So I'm part of a research drug. It's called TB006. You can look it up. TB006. Literally, you can look that up. The company is called True Binding. I'm an investigator. I'm not a big drug person at all, but this is not a drug like any drug that you know of. This is not a drug for amyloid. It didn't work. It hasn't worked. It'll never work for amyloid. The TB006 is a monoclonal antibody. That means that the drug company has found a type of antibody against the specific inflammation protein called galactin-3. Even if you don't understand what galactin-3 is, that's okay. Since the 1980s, chronic inflammation has been associated with a protein called galactin-3, very high levels. They see it in autoimmune disease. They see it in all diseases where there's inflammation, which is almost all diseases. But nobody came up with anything to address it. In Alzheimer's, there's a tremendous amount of inflammation. That's why there's so much byproducts, so much buildup of amyloid. And that amyloid is not eliminated as fast as it's made. So the TB006 is a monthly infusion. The monoclonal antibodies grabs a large amount of these galactin-3, these inflammatory proteins. So those inflammatory proteins cannot do their damage. So even in as little as one treatment, 1 month, or maybe 2 treatments after the second, because the inflammation is held back so much, people see improvements. It could be in their interaction with their loved ones. There could be a few words that weren't spoken. It was something they were doing 6 months ago. Now, this is not me saying it. This is exactly happening, and there's no side effects. So I'm just giving you an idea that not all drugs are equal. It depends on what the drug is going against. If it's going against the true root cause, which I challenge most doctors, all doctors, and most people, it's inflammation at the root. In the brain, it's between inflammation and oxidation. They can be overlapped. And I would say that that brain waves are an integral part of the spectrum. And so when people are suffering at a younger age with symptoms, I encourage them to look for inflammation, because it's not only middle-aged and old people that get it, even young people get it. My own children had it. But the good news is that it's not the end of the world for children. But if someone like myself, we take it seriously. Children are no more than small adults. They have the same organs. They have the same physiology. And that's why I think it's a disservice to have specialists that only deal with children versus adults, men versus women. I'm a primary care doctor that was board certified in internal medicine. I came from England as a general practitioner. I had experience in a lot of different specialties. And I realized that I didn't want to specialize. I wanted to be good at everything: cardiology, neurology, endocrinology. So whether it's the brain, the heart, the blood vessels, and that's where I found functional medicine, because that connected all the dots. And so, we will definitely talk about brain waves, because in the setting that younger people have a lot of problem with maybe staying focused or being productive at college or at work, and they may be labeled with a diagnosis, which then leads to medication. And although I'm not against medication, and it's between you and the doctor, I think in the Western Hemisphere, they're too quick to diagnose, and treatment never deals with the root. It just deals with the symptom. And what I'm saying is that get the blood tested. It doesn't matter how old you are. If you have high inflammation, HSCRP, if you have high insulin, that's a sign of insulin resistance. Those are the beginning of problems that come down. Brainwaves we're going to talk about, that they can be used in parallel. And so, look, Dr. Hafid, I think we're getting close towards the end here. We can talk for hours. I think we should finish off on some call to action. Any thoughts from your angle? And then, I'll give you my final 2 cents.
Yeah, first thing, if you're interested in what you heard, if you have any issues that you like to discuss, please look at the description below. It's going to be to a link to where you can get a free discovery call to connect with us, for you to be able to connect and see what we have to offer and how we can help you. And we're always here to address any questions you guys may have. I appreciate the time you guys have taken to spend your late afternoon with us, or wherever you are in the world. And I hope this information you found was to be helpful. And please look forward to having more of these types of podcasts / live events happen. And we're going to continue on, because we're part of a movement with the Next Health movement. And we're trying to get you all to live past 100.
I couldn't have said it better myself. And so what I would say further is that, whether you're young or middle-aged or old, man or woman, it really doesn't matter. You'll find that if you have complicated problems, or you have a problem without a name, without a solution, as Dr. Hafid said, that click the link below to learn more about what we do. But it's about functional medicine, and whether it's the brain, the heart, and the blood vessels, if you don't know how to measure something, you can't improve something. And so what we do is we match the right measurement for the right symptom. And if you can find out the root cause, that's the real treatment. Anything else is a band-aid. So on that note, what I'd like to say is that stay tuned, because everything that we bring is cutting edge, but we'll bring it back to day-to-day actionable items. But we're going to tell you the real root cause, so you have the power to make the right choice. Until next time, continue a healthy lifestyle, not only living long, but living well.